Welcome again to the Medical Terminology Podcast. This episode is Chapter 8, Part 3, Pathologies. As usual, I'm going to go over the more difficult pathologies, the ones that tend to be confusing or missed on tests. The remaining pathologies are there in the textbook, and I believe they should be pretty straightforward. We're going to start off by looking at pathologies relating to the upper gastrointestinal tract. And so we're going to begin with the mouth. The first term is aphthous ulcers. APHTHOUS. Aphthous ulcers. And this is the medical term for canker sores. And if you're not sure what canker sores are, those are the type of sores that you can get in the lining of your mouth. They are white pits with a red border that's in the soft tissues lining the mouth. Aphthous ulcers, medical term for canker sores. Now, these are often confused with another type of sore that appears in the mouth, and that is the cold sores. And the medical term for cold sores is herpes labialis. HERPES LABIALIS. Herpes labialis. And these cold sores are blister-like sores that appear actually on the lips and the face. They're exterior, whereas the aphthous ulcers are inside the mouth on the soft tissues. And these cold sores are caused by the oral herpes simplex virus, type 1. The next term we have is stomatomycosis. STOMATOMYCOSIS. And this uses that new word part, stomato. And do you remember what stomato refers to? Well, stomato refers to the mouth. Now, the second part of this term is mycosis. And do you remember what mycosis means? Well, that would be the abnormal condition of having a fungus. It's a fungal condition. So putting this together, this is any disease of the mouth that is caused by a fungus. It's a fungal condition of the mouth. The next term is xerostomia. XEROSTOMIA. And if we parse this down, we have the word part xero plus stomo plus ia. And xero refers to dryness, and stomo is another word part referring to mouth, and ia means condition. So this would be the condition of a dry mouth. It's the medical term for having a dry mouth due to the lack of adequate saliva. Xerostomia. The next two we need to pay particular attention to because I think these are constantly confused and missed on tests. The first one is gingivitis. GINGIVITIS. Now, looking at the word parts there, this should be pretty clear what it is. What does this term mean? Well, gingivitis would be an inflammation of the gingiva. And do you remember what gingiva refers to? Gingiva refers to the gums, so this would be inflammation of the gums. Now, that is a different condition from our next term, which is periodontitis. PERIODONTITIS. Well, periodontitis is going to mean inflammation of what? Well, this would be inflammation of the periodontium. And remember, the periodontium is the tissues that surround and support the tooth, including the bones that support the teeth. Okay, this is a much deeper structure than just the gums. The gums are just the surface tissue around the teeth, but the periodontium includes the supporting structures, what actually hold the teeth in. And if you have periodontitis, that is much more severe than gingivitis. You have an inflammation that involves the bones as well as the gums, and it can actually result in loose teeth and teeth loss. Your teeth can literally fall out if you have periodontitis. Periodontitis is also referred to as periodontal disease. So the important thing to remember is gingivitis is a mild just inflammation of the gums. But if you see that the bones are involved and there's a tooth loss involved, that's periodontitis. That's the word you want. It's much more severe. Okay, and then we have a third one that's thrown at us, and this is a long term. It's acute, necrotizing, ulcerative gingivitis. Acute, ACUTE, necrotizing, NCROTIZING, ulcerative, ULCERATIVE, and gingivitis, GINGIVITIS. Now, what does this mean, and how is this different than the periodontitis or the regular gingivitis? Well, if we have the acute necrotizing ulcerative gingivitis, we have an abnormal overgrowth of bacteria that is attacking the mouth, and it causes extreme inflammation and infection of the gingiva to the point that the gum tissue dies. It necroses. So this is like a severe bacterial attack where the gum tissue is actually dying. That's the necrotizing part. If you have regular gingivitis, your gums are not going to die. They're going to be inflamed and red, maybe bleed a little, but it's not nearly as severe. With periodontitis, your tissue's not going to die either. Your gums aren't dying. What's happening there is your bones are getting attacked, and the bones are loosening, and you're losing your teeth. So the key idea with this acute necrotizing ulcerative gingivitis is it's an extreme acute bacterial infection, and you're having tissue death. Okay, so that's important. Keep these three terms straight: gingivitis, periodontitis, and acute necrotizing ulcerative gingivitis. And one more thing I should say about that last one is this is the medical term for something that's commonly referred to as trench mouth. That's kind of an old term. You may not hear it that often, but if someone has trench mouth, they've got this tissue death going on. Okay, now the next pair are also often confused. The first one is pyrosis, Pyrosis. Now, based on its word parts, what does that mean? Well, that would be the abnormal condition of burning, right? Pyro plus osis. Specifically, pyrosis is a medical term for heartburn. And heartburn is the burning sensation that one feels in the esophagus when some of the stomach contents will come up into the esophagus. Sometimes you might burp something up, and you'll feel that kind of burning sensation. And it's coming from the acidic stomach contents. So that burning sensation itself is pyrosis. Now, we don't want to confuse that with our next term, which is gastroesophageal reflux disease. Another long term. gastroesophageal, gastroesophageal, and that's referring to the stomach and esophagus. Reflux, reflux, and then disease, disease. This is often abbreviated GERD, GERD. Now, this term refers to the upward flow of acid from the stomach into the esophagus. Okay? It refers to that condition, the flow of acid up into the esophagus. It doesn't say anything about the pain you feel or the symptoms. Okay? This is just the, again, process, what is happening. The acid is flowing up into the esophagus. Now, that can cause you to feel a burning sensation. And the term for the burning sensation itself is what? Well, that's the pyrosis. Okay? So pyrosis is the symptom. It's what you feel, the burning sensation. A possible cause of pyrosis is the GERD, which is the upward flow of acid. Okay? So be careful of those two terms. Oftentimes people will say that the burning sensation is GERD. Well, no, it's not. The burning sensation itself is pyrosis. GERD is simply the cause, the upward flow of acid. So when you're dealing with these terms, be very careful of what's being described. Now, the next two terms we have are a little bit tricky, primarily because of spelling. And the first one is hematemesis, hematemesis. And based on its word parts, what does that mean? Well, I hope you got vomiting blood. Hemato, Hemat/O, refers to blood, and the suffix emesis, emesis, refers to vomiting. And the reason the spelling is tricky here is it's important to notice that this term favors the word part hemato, Hemat/O. Sometimes people will misspell this because they'll use the word part hemo, Hem/O, and that doesn't work because if you use that, then you kind of have a awkward transition if it's just hematemesis, Hememesis. That's a little bit awkward. So hemato is the favored word part for this, so it becomes hematemesis. The next term is hard to spell because we don't pronounce it at all the way it looks, okay? And that is bulimia nervosa, Bulimia, and then nervosa, Nervosa. And first of all, the meaning of bulimia or bulimia nervosa is it's an eating disorder that's characterized by binging and purging. This is not the same as anorexia, where in anorexia you're not eating at all. Bulimia is the cycle of binging and purging. The reason this is hard to spell is because it's pronounced bulimia, and it sure makes it sound like there's an E in there. It sounds like it should be spelled Bulemia. Let's go ahead and do some practice over these tricky words. What is the medical term for the burning sensation caused by the return of acidic contents into the esophagus? That's pyrosis, Pyrosis. The key idea here is we're talking about the burning sensation, pyrosis. What is the term for any disease of the mouth caused by a fungus? That's stomatomycosis, Stomatomycosis. Again, that could be a little tricky because it uses that word part stomato. What is the medical term for cold sores? That's herpes labialis. HERPES LABIALIS. Medical term for cold sores. Herpes labialis. What is the medical term for inflammation of the gums? That's gingivitis. GINGIVITIS. And what is the term for a condition in which you have the upward flow of acid into the esophagus? Okay, here we're talking about the upward flow of acid itself. So this is our gastroesophageal reflux disorder, or GERD, GERD. That's spelled GASTROESOPHAGEAL, reflux, REFLUX, and then disease, DISEASE. Again, abbreviated GERD. What is the medical term for a dry mouth? That's xerostomia. XEROSTOMIA. What is the medical term for inflammation of the tissues that support the teeth and that can lead to a teeth loss? Well, that's periodontitis because it's involving the supporting tissues, and we could have teeth loss. Periodontitis, periodontitis. It's also referred to as periodontal disease, periodontal, and then disease, disease. What is the medical term for canker sores? Well, that's aphthous ulcers, APHTHOUS, ulcers, ULCERS. Those are the canker sores, not to be confused with cold sores. And what are canker sores? Well, those are those white pit like sores that occur in the lining of the mouth. It's on the mucous membranes, as opposed to the cold sores, which are more blister like and they're on the external lips or the face. Okay, and what is the medical term for the eating disorder that's characterized by binging and purging? Well, that's bulimia, and be careful of the spelling, BULIMIA. And finally, what is the term for a severe bacterial infection and inflammation of the gingiva to the point that the tissue can die? Okay, well, inflammation of gingiva is gingivitis, but this is caused by a severe bacterial infection and we've got tissue death. So this has to be acute necrotizing ulcerative gingivitis. ACUTE NECROTIZING ulcerative. Finally, gingivitis, gingivitis. Okay, those are the tricky terms that affect or relate to diseases, disorders of the upper gastrointestinal tract. Now let's look at the lower gastrointestinal tract. And the first term we have is irritable bowel syndrome. IRRITABLE, bowel, BOWEL, syndrome, SYNDROME. This can often be abbreviated IBS. And this is a condition of unknown cause with symptoms that include cramping, pain, bloating, constipation, and/or diarrhea. And this condition is one of those functional disorders we talked about way back in Chapter 2. It's not caused by pathogens or structural changes. If someone were to do testing, look at the colon, there would be nothing apparently wrong with it, but its function is changed. It's not functioning correctly. The next term is inflammatory bowel disease. INFLAMMATORY, inflammatory, bowel, BOWEL, disease, DISEASE. And this is sometimes abbreviated IBL. And this is not to be confused with IBS, okay, because in this case, there is some disease process going on. This is a general term for disease that causes inflammation of the intestines. These diseases are chronic and can affect both the large and small intestine. So in this case, there's inflammation going on. That's observable, okay? There is a disease process going on, as opposed to the irritable bowel syndrome where there's nothing that it can be tracked down to. Okay, so inflammatory bowel disease is a general term for any inflammation of the intestines, and it's chronic. It can affect the large and the small. Now we've got some terms that get more specific than that. We have some types of inflammatory bowel disease. The first type is ulcerative colitis, ULCERATIVE, colitis, COLITIS. And this is a disease in which we have repeated episodes of inflammation of the rectum and the large intestine. Notice it says colitis, so it refers to the colon. Rectum and large intestine that cause ulcers and irritation. And an important point is this disease affects only the innermost lining of the colon. We have inflammation going on affecting only the innermost lining. Then we have another type of inflammatory bowel disease that's more severe, and that is Crohn's disease. Capital C, ROHN, apostrophe S, disease, DISEASE. And this is a chronic autoimmune disorder that can occur anywhere in the digestive tract, but it's most often found in the ileum and the colon. And this is a disease that penetrates every layer of tissue in the affected area. It's pretty nasty stuff. Oftentimes the treatment is just to go in and remove the colon. So this penetrates every layer. It affects the colon and often the ileum. That's different than ulcerative colitis, where it just affects the innermost lining. And that one tends to be just the rectum and large intestine. Okay, then we've got terms that subdivide Crohn's disease. If the Crohn's disease is in the ileum, which remember is the last part of the small intestine, we're going to call it regional ileitis. REGIONAL, and then ileitis, ILEITIS. And ileitis would mean inflammation of the ileum. So this is Crohn's disease in the ileum. And then finally we've got the term for Crohn's disease that's in the colon. And what would that be? It would be Crohn's what? Well, if it's in the colon, it would have to be colitis. Colitis. Crohn's colitis, Crohn's affecting the colon. Regional ileitis is Crohn's in the ileum. Okay, and finally, we have some terms relating to the accessory organs. Most of those are pretty straightforward, but we've got a few that are kind of tricky to spell and keep track of. The first one is a term for the infection of a bile duct. Do you remember the word part for bile duct? This is a totally new one for us. Well, that's cholangio, CHOLANG/O. We combine it with itis, which means inflammation, and we get cholangitis, CHOLANGITIS. And that would be infection of a bile duct. The next term is for inflammation of the gallbladder. And do you remember the word part for gallbladder? Well, that's cholecysto, CHOLECYST/O. And if it's inflammation, the suffix has to be itis, right? So the combined word is cholecystitis, CHOLECYSTITIS. Then finally, we get to one that's a little bit trickier, and this is the term for the presence of gallstones in either the gallbladder or the bile ducts. And do you remember, first of all, the suffix that refers to presence of stones? That's lithiasis, LITHIASIS. Now, the tricky part here is the combining form. The combining form for gallbladder, cholecysto. But that's not what we use with this because it's the gallbladder or the bile ducts. What we use here is a little bit different, and we're just going to use the chole, CHOLE. Chole by itself refers to bile. So put together, the term is cholelithiasis. Literally, it's the presence of bile stones, because chole by itself refers to bile. What it really means is the presence of gallstones in either the gallbladder itself or in the bile ducts. So that's kind of why we're using the general word part chole, just referring to bile stones. All right, let's go ahead and do some practice. Number 1, what is the general term for diseases that cause inflammation of the intestines? That's inflammatory bowel disease, often abbreviated IBL. Inflammatory, INFLAMMATORY, bowel, BOWEL, and disease, DISEASE. What is the term for infection of a bile duct? That's cholangitis, CHOLANGITIS. What is the term for a chronic autoimmune disorder that can occur anywhere in the digestive tract, but is most often found in the ileum and the colon? And this disease creates inflammation through every layer of tissue. in the affected area. Well, that's Crohn's disease, capital C, ROHN apostrophe S, disease, DISEASE. Now, what is the term for a Crohn's disease that is affecting the colon? That's Crohn's colitis, capital C, ROHN apostrophe S, colitis, COLITIS. What is the term for symptoms of cramping, pain, bloating, constipation, and/or diarrhea that has no known cause? That's the irritable bowel syndrome, abbreviated often IBS. Irritable, IRRITABLE, bowel, BOWEL, and then syndrome, SYNDROME. What is the medical term for having gallstones? That's that little tricky one there. It's cholelithiasis. 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 What is the term for repeated episodes of inflammation of the rectum and large intestine that cause ulcers and irritation, but it only affects the innermost lining of the colon? Well, that's the ulcerative colitis. ULCERATIVE, colitis, COLITIS. Again, it can be distinguished from Crohn's colitis because Crohn's goes through all the layers of the tissue. And speaking of Crohn's, what is the term for Crohn's disease in the ileum? Okay, and that again is a little tricky. We would expect ileitis. It's not Crohn's ileitis, though. It's called regional ileitis. REGIONAL. Ileitis, ILEITIS. And finally, what is the term for inflammation of the gallbladder? Well, gallbladder is cholecysto, so this is cholecystitis. 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 Okay, well, that gets us through the most tricky pathologies relating to the digestive system. And in our last episode, we're going to look at the trickier procedures. This ends this episode of the Medical Terminology Podcast.